Developmental disability throughout a lifetime. Boxell states that music therapy is opening new channels to the furthest reaches of personal development and humanness. Developmental delay is an umbrella term for many diagnoses. I'm mostly going to talk about intellectual disabilities, and autism might add a few in there. Intellectual disabilities are separated by the level of severity: mild, moderate, severe, profound, all under the IQ of 70. Autism used to be separated into autism, Asperger's, Rett syndrome, pervasive developmental disorders. Based on the latest DSM, which is 5, it's now just all one umbrella. So umbrellas under umbrellas. Yay. What's intellectual disability? It's not a particular medical diagnosis or a mental illness. Persons with intellectual disabilities have significant deficits in communication, abstract reasoning, social behavior, motor development. It's important to note that with proper supports, individuals with intellectual disabilities can almost always improve their quality of life. What is autism? It's a neurological disorder. You might see it in the way that they have that autism aloneness, the way they perceive or portray emotion. They might have different auditory or visual responses, attachment to objects or people, and they might have repetitive behaviors. Autism affects individuals in differing ways and to varying degrees. So I said all these things, but it's a spectrum. It's important to note that with proper educational and social interventions, an individual with autism may develop functional and appropriate skills in the areas that I said were issues. Developmental disability is caused in the intellectual disability range. It's caused by biomedical factors, genetic or chromosomal. They might be exposed to alcohol in the womb or to drugs. There's social factors. They might be neglected as children, or they might have limited stimulation in their learning times. There's behavioral factors and there's educational factors. But more about the biomedical. There's low birth weight, prematurity, genetics. Those all are reasons. What's the cause for autism? There's no clear cause. There's an indication that there are differences in a neurotypical and individual with autism brain. Current research suggests that there may be a genetic origin, but it's not just from one gene. It will probably be 10 put together. Intellectual disability, it's usually seen around 9 months. You can see that a child may show difficulty in gross motor functions or in the way that they respond to a caregiver. At age 3, there's a lack of imitation skills, trouble following directions, avoidance of eye contact. Characters of autism are noticeable at a year to a year and a half, but they're mostly diagnosed between ages 2 and 3. Ball had this information in 2008, which is before the new DSM, but Asperger's is usually diagnosed at age 7, probably because they're still meeting educational milestones, but not the social milestones. So that's why it takes a little bit of time, even though it's not diagnosed autism. The individuals who had the characteristics of, it's not Asperger's. They have the characteristics of Asperger's, and it might take them longer to diagnose that. Okay. Intellectual disability, like I said, sub-average intellectual functioning and IQ score below 70. They also have behavior limitations, which affect their ability to function with receptive, expressive language, reading, writing, money concepts, self-direction, social skills, and practical skills. For autism, they have symptoms that show qualitative qualitative impairments in communication and social skills, expressive and receptive language, limited range of interests and activities, and also they will exhibit self-stimulating behaviors. So, social skills. They might repeat words or phrases, which is echolalic. They'll have that aloneness. They'll have difficulty interacting with their peers, and visual avoidance. They're going to have minimal direct eye contact. Interacting with others under expressive and receptive language. Their responses to verbal cues or directions might be lacking, or they have unusual responses. For interest in activities, I thought it was important to note that sometimes there are individuals under the autism umbrella that, wow, they're really good at math, or wow, they're really good at music. This isn't for all individuals with autism. They will have ritualistic behaviors, sameness of routine, or resistance to change, odd or unusual play, just like the responses, it's unusual, and they might have attachment to objects or others. They also might exhibit self-stimulating behaviors, repeated body movements, rocking back and forth, and this is due to an oversensitivity or a less response to stimuli. They just can't respond to hearing things the same way because it doesn't come through in their brain the same way. If you know one person with autism, you know one person with autism. Not all of them have anxiety, but here are some things that you might see. Anxiety, inability to focus, repetitive or disorganized movements, subtle lilting around a room. They might walk on their tiptoes. Confusing or undefined sensory sensations. They might be very, very active or barely active at all. They might have social ineptitude and the cognitive and emotional setbacks. Those are kind of covered before. They might have trouble being flexible as through events, and they might have motor planning deficits. That's prior perception, which I'll talk about a little bit. Areas of need. So, cognitive skill areas, adapted skill areas, academic, communication, social, self-direction, leisure skills, physical, motor, and behavior. Reasons for behavior in a child with autism might be they might be self-stimulating, they might have obsessive compulsive tendency, they might be attention seeking, they might be escaping and avoiding something, they might be trying to get something, give me that food or give me that light up toy. But the big thing is if an individual is having a behavior, they're trying to communicate. So when a client or child with autism learns ways to interact appropriately and communicate their wants and needs, there should be a success in interactions with others, and bad behavior should decrease. So here's some factors in therapy, the assessments that you're going to look at, because behaviors have many contexts: biological, psychological, and sociocultural. But it's important to be knowledgeable about neurotypical development in children and adults. So, the goal is awareness through communication. And important to note, my reminder is that all changes that a client makes, they need to be motivated to do that intrinsically. So here's some ideas in therapy. The brain matter from my Berger book, Eurythmics. The proprioceptive, the tactile, the visual, and the auditory part of the brain all work together to respond to music or respond in any way, shape, or form. That's important. That's how the brain works. Okay, so I have the group therapy and the one-on-one therapy, and then I have the improvisation, composed music, and adaptation to music. So let's go more into our colors. Improvisational theories with music therapy. With modeling and facilitation, a client can access imaging and sound organization skills. With improv, you will reflect, match support, change, and redirect behavior. This brings about a congruence and synchronicity within a person. They're able to really understand or feel or know what their brain is going to do because they've done this in improv before. They've made decisions based on where they are at. In composed music, this can help specifically with behaviors or with locomotion. Also, composed music, you might use it to convey moods through a familiar song or the context that come through that song, certain ideas, objects, or people. Adaptive music, so when you take music and you perform it on your own, this you might make these changes based on the functioning levels and the needs of the client. It builds creative expression and it utilizes musical dramatization. Back to that group and individual therapy. So, some of these things that they have are the same. Through successes, they can find better self-esteem. Auditory processing and memory, it is improved and refined. Speech and language skills, expressive, receptive language, fine and gross motor. Individual therapy would be doing more specific tasks towards fine and gross motor. There's academic concepts. Okay, so let's talk about music. Group therapy. They might work with attention to a task, leisure activities, self-expression, and social skills. Individual music therapy, it might improve visual perception and reinforce basic concepts. Therapies used. This one's really busy and colorful as well. So, I will explain reflection, identification, and our context song, but let's talk about how you use music. Oh, look, there's an arrow. I'm going to talk about more about music as well. You use music through music and movement, singing, chanting, instrumental playing. How do you individualize your therapy? Through changing how an individual is expected to participate. You might change the way that you are giving them information or the way that they are giving information back. You may ask less of them. You may change the level of the difficulty as well. You may give them more time to do things, or you might change the instrument or the space that they're in based on what their needs are. You might give them more or less support, and use visuals, yes. So, Wigram gave us a pretty cool order of events. I am learning that having an opening to a music intervention and a closure is very important. There's free and structured play, which, according to this one, was very improvisational, but free improvisation and then structured improvisation. Then they would introduce new instruments or new material, the things that you might want to work on with motor development or with social skills. And then the way that you reflect what you did on, different kind of reflection, you discuss it, and then the containment is a supportive environment where the client can really try out what they're learning. Okay. The body cannot be talked out of poorly behaving psychologic system that is causing psycho-emotional problems. You can't convince your body to stop doing something that it's doing. But music has elements that the body understands. You can't talk it out, but you might be able to, with periodicity, complex frequencies, and structure, you might get that message and the body will understand through music. Reflection, identification, our contact song. Reflection is where they're screaming, you're screaming, scream, scream. But you do it in a music thing. You take what they're doing and you give it a music context. With identification, Jordan is screaming. I am screaming. We are screaming together. Ah, you put a name to what they're doing, but you're also putting their name on what they're doing. And then the context song, the client is the one that initiates it. It's what they prefer, what they choose, and it provides a connection upon which the music therapist can have a therapeutic rapport. They scaffold upon it to learn new things. Music in as therapy. Let's learn about the different things that go into music. In rhythm, there's pulse, pattern, repetition, and tempo. In melody, melodic contours have the ability to affect emotions. And the way that this is kind of given in the Berger text is laughter is an exhalation. Haha. Sobbing is an inhalation. So you can make your melody happier if it sounds like it's exhaling the whole time. Harmony. Harry Potter on the brain. It adds depth and texture, color to the piece. Timbre is the texture of the specific sounds. You have a soprano and you have a bass. There's things that are inherently definitive of those sounds. In dynamics, you have softness or loudness. You might use this to improve motor functions. You might have them hold a stick, and as they're learning to control their dynamics through that, they're learning how to use their hand in an appropriate manner. In form, the peaks and valleys that create anticipation. It's you're waiting for it to happen, and then it happens. This can teach waiting skills, turn-taking skills. So now we're going to go into early childhood in schools and in the community. Special education services for early intervention are covered under the IDEA, ages birth through 2. Early intervention is a federal and state program. On the IFP, the Family Service Plan, you might have some of these. You will have some of these things. The intensity of the engagement, the individualization of the plan, family involvement, plans for specialized curriculums, objective measurements and progress, opportunities for inclusion with typically developing peers. That's part of the least restrictive environment. They need to be able to learn along with their peers. And it's also important that with intervention, it gets the earliest possible start. As soon as you start seeing those signs, get that intervention going. The goal of early intervention is to give very young children a head start and close the developmental gaps that may have arisen due to disability or to an at-risk condition in their lives. So I have this study here that Smith and Lovelace conducted research in 1993 that basically stated that after 40 hours of applied behavioral analysis, ABA therapy, they saw that it assisted in the recovery from autism. Don't like that phrase, but it was 1993. They were using those tools to help individuals who had autism. That's kind of what it's turned into now. So, when you're doing interventions with early childhood, it needs to be developmentally appropriate. The goals need to be achievable at the same time as they're challenging. Your decisions need to be based on typical child development, and also the child that you're working with. You're reducing the achievement gap. Your curriculum must be effective and comprehensive. So there are these different types of development that you can also look at: play skill development and musical development. Through play skills, children learn about aspects of the world. Through spontaneous play, they learn about, the example was in a sandbox. A kid that is measuring and learning how things fill up an area. But if a child has rigid play, they're not learning these same things. So, here are the different stages of play. There are 2 different takes on it: functional, constructive, symbolic, and games with rules. And then there's one based on interaction with others. There's um, unoccupied, solitary, onlookable, parallel play, associative, and cooperative. I kind of look at the games with rules and cooperative play. They're on the same level. They're that end goal. For musical development, you have through months 0 through 9, reflexive, where they react to changes in the musical environment and they move their body to music. Then you have intention, 9 months to 1.5 years. They have they can find a sound, they can recognize a song, and then they can put their hand in, put their hand out. And then 1.5 to 36 months. Um, they can tell certain pitches. They can tell the direction of the pitch, the contour that it's going to follow. They will have memory of certain lyrics, and they also have increased motor control. In schools, there are 13 disability categories under which a student can receive special education services under the IDEA. So, their rights are 0 reject, non-discriminatory evaluation, that's social, cultural evaluation, appropriate education, that's individualized to them, the least restrictive environment, and then parents and students are supposed to be a part of the education process. Within schools, over 6 million students ages 3 through 21 receive special education services under the IDEA in 2007. That was 10% of those students. So you're going to see inclusive music classrooms or self-contained special education settings. Music interactions and structured instrumental playing are effective to improve social skills. There's a long-term increase in social problem solving, and then there's also you improve social problem solving when you are affected through music. So when playing, making a transition into a classroom, greeting people in a known situation, you apply songs to these things, and an individual with autism has more success when doing, saying hello, coming into a classroom, and playing with others. When given the tools for communication, a client will have the power to meet their needs, manage behaviors, and interact meaningfully and socially with peers. You give them the communication tools, and they will be able to use them. I'm going to start. Think about the skills that you need to make changes in your life. You need to be able to communicate what you want. You need to be able to set goals. Make choices on those goals, on what you want. Manage your time. Identify and solve problems. Learn how to access resources that will help you solve those problems. And you need to be able to self-advocate. So, we've seen the IFB, the IEP, and the ITP. And here in Oklahoma, it ends up being an IP, individualized plan, at the end. But the transition plan, you might see work, post-school options, income support, and insurance, residential options, transportation, medical needs, recreation and leisure skills, the things that as children, as individuals in a school setting with developmental delay, you're working on those leisure skills. Maintenance of family friend relationships, a social and communication point. And then there's advocacy. So, paying bills, doing laundry, studying, even getting out of bed for class in the morning can be especially challenging for students with autism. However, they can thrive in the community if they have the right support. The Americans with Disabilities Act, ADA, eliminates barriers, physical barriers, and discriminatory barriers for people with disabilities. So here are the major functions that are bothered by this: mobility, communication, learning, social skills, emotional well-being, and employment. The entitlement and anti-discrimination laws work together to provide appropriate accommodations for individuals with disabilities. So, it works together under the law to make sure that they're taken care of. Well, that was the birth through life of birth, schools, community, basically the whole life of an individual with a developmental delay. Thank you for watching my video. Let me know what you think. This is Jordan Benton. Thank you. Goodbye.